Hello and welcome to your program of choice, Health Affair, a platform where we explore public health issues, challenges of women and children, profiling lasting solutions. I am your regular anchor, Oshuomowa Daniels. We're going to be continuing with our last week's series on quackery in the medical sector. Please don't go away. We'll be right back after our news segment. Elated Chief Christopher Folajimi Ajayi dancing there amidst friends and club members to take over the mantle of authority as the second president, Lagos Metropolitan Lions Club, for the 2021-2022 service year.
Congratulations, that is hallmark of Lionism. That is the symbol of authority of your club. You use it for several purposes, which I know you know. Please use it wisely, intelligently, and with caution. God will see you through this assignment.
I, Lion Chief Ajayi Folajimi Soba, hereby strike this month, show the commencement of this life.
Welcome the President of Lagos Metropolitan Lions Club.
Though Lagos Metropolitan Lions Club is young, it has done a lot in service to humanity, a record that the new president intends to improve upon with the STAR project focusing on environment and health care.
I joined the International Association of Lions Club officially on this day, 9th July 2020, under the capable leadership of our beloved chartered president, who has continued to guide us in the path of Lionism, keeping us in the bonds of friendship, resonating the passion of helping others. It is indeed rewarding to serve humanity selflessly and passionately, paying detailed attention to those differently abled and underprivileged. As we are seated here today, let us note that Lion Club is not a gathering of the wealthy in the society, but a coming together of a radical givers of time, treasures, and talents to meet humanitarian needs in our communities. We have been pledged to support hunger relief, protect vision, fight diabetes, join the warriors, childhood cancer, while providing support and care, protecting our environment, supporting educational institutions, as well as many others. We have planned a legacy project that is a 10-unit laboratories facility for Jubilee Government Primary School, Dr. Agege, Lagos, to be delivered by March 2022.
It's a need for them because they have a collapsed lavatory, and of course they are using the bushes around the school environment, which is not healthy environmentally, for their health and otherwise.
It's a thing of honor, and it's also a privilege to serve, because Lionism is about service to humanity. As you can see, what we are doing here is usually an annual ritual to usher in the new president and other club directors. And it's also an opportunity for us to raise the needed fund to be able to meet our responsibilities, also to meet our service activities and the projects.
In commemoration of the 2022 World Cancer Day, the district governor, Lion Kayode Oshinuga, used the opportunity to dwell on childhood cancer and the need for more awareness.
More on childhood cancer. And what we do in childhood cancer is to advocate, to let people know what is cancer, to be able to identify it early, and to be able to seek medical attention before it becomes a problem. So we'll be educating the people, we'll be doing advocacies, and we'll be telling people what to do and what not to do, so that we can avoid the scourge of cancer.
Awards were presented to deserving individuals at the event.
You know, I've always told you that we are very proud of you. Everywhere in the district, we are very proud of you. They say a prophet does have honor in his home. Yours is an exception. Even your club members appreciate you. Isn't this emotional? Congratulations. This is for your club members.
Founded in 1917 by Melvin Jones in Chicago, USA, Lions Club is a gathering of persons who are passionate about service to humanity with a special focus on diabetes care, childhood cancer, blindness prevention, environmental preservation, hunger relief, youth empowerment, and literacy. Lions Club International is the world's largest non-profit and humanitarian organization with over 1.4 million members and more than 48,000 clubs. A medical doctor par excellence, one of Nigeria's finest dental officers who has served in various capacities in the public health sector. In the last few months, she has executed numerous projects for the Apex Lions Club, which spans from campaign against drug abuse in some secondary schools around Lagos State, donations to the pediatric cancer ward at the Lagos University Teaching Hospital, LUT, Idiaraba, Lagos, and lots more, as she officially takes over the mantle of leadership as the 8th president of Apex Lions Club for the 2021-2022 service year. With this fundraising and investiture ceremony, Lion Dr. Matilda Brymer promises nothing but continued excellence and selfless service to humanity.
I am Dr. Matilda Brymer. By the authority vested on me, I hereby signify the commencement of the 2021-2022 Lions Service year.
Thank you very much. Can I call our daddy?
I make service as my way of life. So help me God. My district governor invited guests and friends. These are the newly officers of Lagos Apex Lions Club for 2021-2022 Lions Summit year. Congratulations, and I wish you all the best.
Make a difference in our communities. And what we do is put a smile on the faces of people.
She must promote good fellowship, mutual understanding, and harmony amongst our members. You know, any organization is only as strong as the members of that organization. If the members are happy, they will be able to do something for the community. But if the members are not happy, then they will not have that cohesion, that good fellowship to be able to serve the community. That is one. Number two is that they must continue to serve. Like I said, any Lions Club that does not offer service to our communities is a social club. Social club transmutes to Lions Club. Lions Club do not transmute to social club. So they must also continue to offer service to their communities. So those are the challenges which we have to face and which we have to tackle them. The club is a very good, very stable club. Among all the about over 80 clubs we have in the district, it ranks among those with A ratings. So, like I told her, getting to the top is not the issue, remaining there is the challenge.
The expectation is much from her, add more value to the Lions Club in the area of assistance to the most less privileged people.
In line with the 5 focus areas of Lions Club International, 3 of the club's major projects for this service year are basically core health.
In this Lions year, we still have a lot of activities, presentations and donations. And among them are, we have a renovation plan to refurbish classrooms, build tables and chairs. At this Pastor community, there's a nursery and private school there with the floor not conducive, the windows, the atmosphere not conducive for learning for those little children. So we're trying to raise funds, and part of that's why we're here today, to also raise funds to help us. And today is just the first fundraising in the series until we meet our target to renovate and refurbish these classrooms, give them tables, and we want to sink a borehole with 2 overhead tanks and an outstand stand of 4 wash-hand basins at the newly built Anthony Health Center. There's a health center that's just been built, and there's a need to put water in place. It's one of our projects. In this Western community, there's a primary health care center, they have needs. And because it's our unit community, we're also targeting, looking at how we can help them. We have wheelchairs that we want to donate in this times here to the government hospital and the disabled community. We We've been able to do some, we still have 10 more to go. And that's why we're soliciting that even though we have this fundraiser today, it doesn't stop today. When you think of Lagos events and all we need this money for, just find it in your heart to transfer the little bit God has given you into that account. And I promise you, it will be well used for the purpose it was meant for.
Diabetes, vision, pediatric cancer, basically core health. Even though environment too could be linked to health, but it's not core health. Sure, you understand? So we are facing all these issues all together. We are facing all this. We are doing advocacies around all our communities. We are also doing infrastructure. In another Saturday, next Saturday, February 5, we will be laying the foundation stone for a dialysis center in Kwara State, Erinle precisely, in Kwara State. So we are expanding the scope of our service, the scope of our reach to every nook and cranny of our community, so that people can access this health facility at very reasonable cost and without having to travel for too long.
I picked on some focus areas of Lionism, which is diabetes care and eye care, and I deliberately developed a thesis on the prevalence of those diseases and to show that the health indices in Nigeria are very poor and that the current brain drain phenomenon is making it worse. And so I was encouraging Lions to try and shift their emphasis from building infrastructures to community awareness programs, screening programs, in order to prevent blindness that may be caused by diabetes and glaucoma.
At the event, individuals who have done well in their various fields of endeavors were honored. Chartered in 2013, the Apex Lions Club has contributed greatly to human and national development in no small measure.
The federal government has launched a national HIV self-testing pre-exposure prophylaxis communication strategy. The strategies are approved tools in the National HIV Combination Prevention Package, especially targeted at those with a substantial risk of HIV infection. The Director General, National Agency for the Control of AIDS, Gambo Aliyu, tasked people to embrace HIV self-testing as it affords people the capacity to know their HIV status right within the comfort and privacy of their space. The Traditional Medicine Board in Lagos State has opened a Nature Can Fix You alternative medicine specialist clinic in Omole Estate of Ikeja. The chairman, Lagos State Traditional Medicine Board, Adebukola Adefule, called for collaboration with orthodox practitioners to deepen the practice of traditional medicine. She also asked that government, traditional and conventional medicine work together to ensure better delivery of improved health services to the people. The Director General, National Agency for Food and Drug Administration and Control, NAFDAC, Mojisola Adeyeye, has called for more funding for research and development of herbal medicine. The NAFDAC boss, who said investment in herbal medicine research and development would positively impact the economy of the pharmaceutical traditional medicine industry, added that herbal medicine is very important to healthcare delivery and can contribute significantly to universal health coverage. Adeyeye also said investment in herbal medicine research and development is needed from all stakeholders, including the government. The National Agency for Food and Drug Administration and Control, NAFDAC, has stopped the registration of alcohol in sachet, small volume PET, and glass bottles below 200 milliliters. The Director General, NAFDAC, Mojisola Adeyeye, who made this known, said the ban was effected following the recommendation of a high-powered committee of the Federal Ministry of Health and NAFDAC. Adeyeye said the producers of alcohol in sachets and small volumes had agreed to reduce production by 50% with effect from January 31st, 2022, while ensuring the products are completely phased out in the country by 31st January 2024. She added that the move by the agency is part of measures to curb the abuse of alcohol across the country. The leadership of the union NUAP arose from the Congress of Members on Monday with a resolve to suspend the planned strike action. The union members said it became necessary in view of the persistent appeals by the government to put the strike on hold and the assurance of a fruitful outcome as regards their demand. The EXCO and Congress decided to display high sense of empathy towards the patients and optimism of the government in acceding to their request. The Nigerian Association of Resident Doctors (NARD) has urged the federal government to increase the budgetary allocation for the health sector from the subsisting 5% in the 2022 budget to a figure closer to 15% as recommended at the 2001 Abuja Declaration for Health Financing in Africa. According to the doctors, this will help to improve their welfare and contribute in reducing the brain drain experienced by health workers in the country. They also said it will enable more employment in the sector, improved welfare and service conditions for health workers across the country.
Nigerian women and children are being recruited every day under the guise of a greener pasture. These women are saying it is time to put a stop to this menace called human trafficking.
I don't have anything doing in my hand, and I saw somebody that just came as a destiny helper that said that yes, I will help you. Like I will help you and give you a job. You still go to school. It's not easy for us to, from Ghana back to Nigeria. It's not easy. We went through a lot. We went through so much. We went through pains when we run from the beginning of our madam's place. So we went to the police station. After the police station, they helped us and we suffered through a lot. Our way coming back to Nigeria, they still attacked us. If they are pregnant, they will abort the pregnancy or they will kill you. If they did not abort the pregnancy, they will give birth to the child and they will sell the child. You will still continue your job.
It means as if they were commodities to be sold, to be used, to be battered, to be abused, defiled, and then discarded. Human trafficking is very, very evil. It's inhuman. And so at every point, in our houses, in our churches, in buses, anytime we get opportunity, we should condemn it.
Letting people know the evil of trafficking human beings, especially our young girls, the rate at which they are being taken out of the country, even within the country. And we talk to ourselves too, as mothers, as women, we have to know what to do when people come to us to lure us into taking our children away from us to go and use for different kind of jobs, either outside and within the country. We should be very, very careful.
Government can still do a lot to help these young people from being exploited. Because we should go to the causes of human trafficking. What is causing it? Unemployment. Our young people have no future. You know, the homes are shattered, the homes are broken. And because parents have no means of taking care of their children. So the government should make sure that young people are gainfully employed.
If there's anyone around us that is passing through this and you know them, please say it out. The agencies are there, like these cards we are having today. There are telephone numbers all over the world they can call, and at least the government will come to their aid through the agency.
People have been encouraged to be mandatory reporters of sexual and gender-based violence cases in their immediate communities to make Nigeria a society where all women and young girls enjoy sound health, equal development, and maximum self-actualization without fear of harassment. This was the message of some speakers at the meeting of Agents for Citizens-Driven Transformation Program in Lagos, supported by the British Council and European Union on how civil society groups can improve on response to cases of gender-based violence.
All the civil society organizations are well equipped. When they go out, they should look out for people that have been abused. They've mentioned a lot of challenges that they face, like stigmatization. People don't want to report issues of abuse. But if they are equipped and they tell community members about their rights, they will easily report those cases of SGBV to them. So when they report these issues of SGBV, they should be able to handle these cases very well using the best standard practices.
There is need to refer. That is why we also have to cooperate with other organizations. And then community awareness is key. We need to inform the community to tell them that they are very, very safe if they report any case of sexual or gender-based violence, that they are being covered. Yes, it's left to us that have been trained. We need to go out there to create community, to create awareness on our own individual community, and then help that layman in the community to understand what it is. That is why we are trained. We now have to go and train others in the community and let them know what they are supposed to do and how they will be protected.
Some of the participants earlier trained were able to follow up on practical cases of some families in Ojo, Oshodi, and Isolo local government areas, identifying the root causes of abuse and possible solutions.
A case of a girl who is having sexual harassment by a neighbor was reported to our NGO. But though very unfortunate, the girl, she reported the case to her parents, but both her mother and father refused to believe her. So she ran out of the house. Up till now, she has not come back. So we are still tracing her. Anytime she comes back to the house, we want to have one-on-one discussion with her so that we know how to handle the case.
I was at home on this fateful day, that was last year, within October and November, to be precise, October. And they just knocked on my gate that a girl is outside crying and saying she doesn't want to go home. When I got there, to my greatest amazement, I saw all over her body beating. She's a minor, to be precise, 11 years old. I looked at her, I said, well, you know, I have a picture of her here. All over her body, beating. He said it's her auntie husband that beat her because she kept her younger brother's food in the fridge. I said, is that the reason? And she's not going back home. Then eventually, I were able to find out where she was staying. And we got there. People, the women were angry, the men were angry, and I said, okay, let's go there and find out what really happened. When we got there, I saw the husband's, the sister's husband who beat her up in the house. He was drunk.
And then she came up with a whole lot of stories about how they've not been eating for a month. Even she said they slept without food 2 days ago, and the children have become malnourished. So as an NGO, I believe it's also our responsibility to cater for some of the financial needs of people around us in the community.
For the family of Ajay family, this particular family, we discovered their challenges. Number one challenge they have is poverty within the family that really cause fighting on a daily basis. Then when we look at the other challenges, we see lack of understanding. We saw that also within the family.
To promote uptake of justice and support for survivors of sexual and gender-based violence case management in Nigeria, about 37 persons were trained by the European Union, the British Council, and the Women Rights and Health Project in December 2021. Israeli health officials have called on all adults in Israel to have a fourth COVID vaccine. According to Israel Health Ministry, the fourth dose doubles as protection against symptomatic COVID-19 and increased protection against severe illness by 3 to 5 times and is recommended for people aged 18 and above. In late December, Israel became the first country to extend fourth doses to people over 60, healthcare workers, and those with weakened immune systems.
Welcome back. We spoke with a medical expert, Dr. Adeshola Kayode, last week about the menace of medical quackery. Let's continue.
One of the major things is, economic gain. You just want to have something to... Why will a pharmacist not know that, look, it is not your job to make diagnosis? There are a lot of illnesses that a doctor will not make diagnosis on until he has examined, until certain tests have been carried out. So why would somebody just come, the baby has been vomiting, stooling, and blah, 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 and the next thing, across the counter, have you given flagyl? Have you given the... And you begin to prescribe, begin to say this is what the baby wants, or this baby... That is very wrong. Supposing there's a mass in the tummy, and you need to check and detect that mass, and once you treat around that mass, that will be the end of that problem. So most times it's economic gain. A man who wakes up and is jobless and is doing vulcanizing, and then suddenly remember that his grandfather used to deliver pregnant women, and goes to set up a place and begins to call himself. Of course, those people are the people they quickly call doctor. They also hang some word coat on themselves, and before you know it, even when they are in their buka or corner side of the street playing draft, everybody will be shouting doctor, and they become more popular than even those of us that are trained as medical doctors. Those are the things. So, but the major thing is economic, advantage or benefit. People do it. The pharmacy knows it should not be going as far as, will you tell you, oh yeah, open your tummy, let me see, let me check you, let me examine you, or let me see. I was told of that same doctor reported a case of a woman with breast cancer. She presented and they were giving her all sorts of drugs. By the time they realized it had gone to stage 4, and that was the last stage with metastasis. That means it has spread to other parts of the body. So what are we doing? Waiting for her to die. And she came into the real hospital now, came in severe pain and everything. And the moment we opened that, immediately any doctor, we know that this is the stage, and it's a late stage. If you like, go to the so-called India they used to run to, nothing will come out of it. So it is that economic, that person will have seen that patient and say, go and see your doctor. Quickly, go and, not let me give you this, let me write this for you. Or you have been trained as a laboratory scientist, laboratory technician, and you have seen this woman or a man and you have run your test, the proper thing for you, okay, take it to your doctor. Not, okay, after you've done your own job, you've finished, you've given the result, that this is the result. You don't go to, because you want to make some extra money where it shouldn't be. So I believe economic drive, and because most policies in Nigeria, even where we have them, we don't drive them. And that's why many people live above the law in Nigeria. Why is it that a lot of times, after these nurses have taken them up and wasted their time, wasted their money, and pushed them further down, why is it that they eventually will tell you, better go and see a doctor? Why at that stage, when things are already getting out of hand? That should tell you there's a difference. And besides, health is never a free commodity. If you want good health care, you have to be ready to pay. And in this part of the world, some of us have been like agents preaching that people should embrace health insurance. If you have health insurance, you'll never be afraid. And that's where another click there that will tell you that people know what is right and what is wrong. For those that have the health insurance, either the national health insurance or those ones by private HMOs, any little thing they want to come, that tells you they know the difference. They know the difference. So that's why I said a lot of people are unnecessarily afraid, thinking that going to the hospital will be more expensive. And when they think they go to government hospitals, the stress, the protocol and whatever drives some people away. And besides the experience of some people, because like I said earlier, most of the hospitals are short-staffed now. And so when you push in too many people, they give you some dates longer than what will help you. Because they are human beings, they cannot cope with what's already on ground. So it's really a very complex complex cycle, and it's getting worse and worse every day. So I will be suggesting that if government on one side will deliberately decide to start curbing quackery in the health sector, it will go a long way. Encourage people. And then the health insurance program that we are saying, rather than behaving like a master slave to those few health providers, doctors and nurses that are remaining, try to embrace and listen to them and see what will help to have. You cannot be the master and thinking that you're breathing down people's neck. That's why a lot of people are going. When you, instead of listening to them and trying to make corrections, you want to force them to say, no, it must be your way. And you will never walk that way. These are professionals, highly needed in other places, highly appreciated in other places. So if you are not appreciating, oh, too bad. Pack. A lot of people will just say, let's pack our baggages and leave. Go to the right place where you have qualified medical personnel. Because at the end of this, like saying, penny wise, pound foolish. There have been a lot of cases that probably you will have spent 10, 15,000 or even much lesser. There was somebody we had in December here, and I was telling her, I said, look, madam, if you had come earlier, you wouldn't have been on bed. You wouldn't have spent more than 5,000 or even less just for treatment. Now they have complicated things for you. Your first deposit was 30,000, and after that you've had to pay some extra money. So if you go to the right place at the right time, you will end up spending much lesser. And at that point that you are presenting, where you are spending much lesser with the qualified doctors, qualified medical personnel, at that point you are spending lesser, your health safety is guaranteed. You don't come at the time after you've spent some money somewhere. You're not coming at a point where you have become so bad and nobody knows what the outcome will be. You can compare the two, that they are not, in fact, they are not comparable. One is where you walk in and you are spending a little money, more than what you will have given to quacks here and there, and you are sure. And nobody is afraid then that this thing might go the other way. Compared to when you have to wait, trying to spend little, and sometimes when you hand off those little, they become more than what you will have spent confidently seeing somebody whom you know you trust and whom you know is well trained in the field to provide you that service. So it's always like I said, case of penny wise, pound foolish. Let Nigerians begin to. You don't have any business getting diagnosis in a pharmacy shop. You don't have any business being treated by a laboratory person, because they are not trained to treat you. They are not trained to even make the diagnosis. You cannot go to a scan center and begin to take treatment. You cannot go to an X-ray center and say, oh, after the X-ray, this is what you should do. They refer you back to the people that are trained. The people, those things they are doing, they are just to help us, to aid our judgment, so that we know what is right. Sometimes we know more than 90%, this is what the person wants and has. But we have to use that test to confirm that, okay, this is what I'm suspecting. And by the time the test comes, okay, so it's confirmed, this is what it is. Then I can now move into treatment. Just like you see a University of Ibadan hospital, University College Hospital Ibadan, that UCH Ibadan, trained doctor. Most times you come to me and you are sitting there and say, doctor, I don't go do this test. I will tell you, keep it aside. Let me talk with you. Let me know. Let me have an impression, so that I don't get influenced by whatever test you have gone to do, which sometimes might have even been done by wrong people and misleading. So sometimes I could talk to you and I will say, no, this is your result, throw it into the basket, dustbin, because it's not tallying with what you have. You are not trained to diagnose, so you don't expect them to even get it right. And where one nurse has seen a doctor treating a particular case based on certain complaints, she might not have known that there was something the doctor detected somewhere that made him to say, oh, this must be this, and decided to give this line of treatment. So next time you go and you see swelling, this and that, and then you think you can use that, apply that to every other case. They are not trained to diagnose, so you don't expect them to even get it right. And where one nurse has seen a doctor treating a particular case based on certain complaints, she might not have known that there was something the doctor detected somewhere that made him to say, oh, this must be this, and decided to give this line of treatment. So next time you go and you see swelling, this and that, and then you think you can use that, apply that to every other case. This is not going to be. Imagine a woman with ectopic pregnancy. Ectopic pregnancy will present in so many different ways. So if a nurse who has seen just one does not really know other things that a doctor will need to examine or confirm before making diagnosis, it will be misleading the patients out there. And it's of course, ectopic pregnancy, if you don't do it properly, it leads to death.
Thank you very much for coming on the
You're welcome.
show. We appreciate you.
You're welcome.
If you are just joining us, It's Health Affair on AIT, and next is our nutrition segment, an aspect of the program that talks about eating right to stay healthy.
Locust bean, commonly called Iru in Yoruba, Ogiri in Igbo, and Dadawa in Hausa, is a local seasoning used in preparing soups and stews. It can also be referred to as the African locust bean, with the botanical name Parkia bigilobosa. The locust bean can be found in a wide range of environments in Africa and is grown for its pod that contains both sweet pulp and valuable seeds. Research shows that locust bean helps to promote good eyesight and aids in treatment of health conditions like hypertension, stroke, diabetes, anemia, and malnutrition. Consuming a good amount can equally reduce fever and boost the immune system. The most valuable part of the locust bean is high in protein, carbohydrate, fat, calcium, and other vital nutrients cherished by the body. Consuming locust beans is good for your health.
Please come with me to our clinical segment for tips on healthy living.
People take their drugs with soft drinks. Some will put it inside eba and swallow. Yes, it may not affect some drugs, but most times we advise that you take drugs simply with water. But there are some that will make an allowance and ask you to take it maybe with something like milk or any beverage that doesn't have antioxidants in them. Antioxidants are things like fruit juices, and some of the soft drinks we may take may contain some of these antioxidants and may affect the drug that we're taking. Particularly the anti-malaria, which we take, the artemether-lumefantrines, the ACTs as we call them by short. Most of them are affected when we take them with any drink or any food that is heavy laden with antioxidants. What they do is to neutralize the drugs, clean them off, and throw them out. So drugs should be taken most times simply with water. But if there are times when you need to use other things to take them, always consult your pharmacist. Your pharmacist will be able to tell you, because since they understand the pharmacokinetics and dynamics of these drugs, they will be able to guide you better.
Be a part of nation building by telling us how to improve on the nation's health sector and human lives.
People wondering why we're making it compulsory. There is no country in this world that is running a voluntary scheme that has been successful. And the simple analogy is when government says, insure your car, everybody runs up and down. Because if the police stops you and you don't have an car insurance, you're in trouble. But when they say insure your health, everybody is looking at, why not? So which one is better, your life or your car?
A stitch in time, they usually say, saves 9. Please, let us all invest in preventive health care and make regular health check our way of life to avoid regrets and needless deaths. This is where we draw the curtain on the program for this week. My name is Oshuomuowa Daniels.